alumni, seniors, because uh, I have joined late. The, so I hope this is actually the Savitri madam told me to start exactly sharp at 9 o'clock, but we are running 20 minutes late. So for that I ask sorry. So today's topic is scientific paper writing and publications. So you can see the tagline: without publications, science is dead. See, nowadays, uh, if you compare with other science, contemporary sciences, the the publications, how much they are doing the publications, how much the scientific communication, and altogether that increases that helps in growth of the science. Parallelly, the even the doctors also. See, the science, no matter how spectacular the results are, the work is not completed until the results are published. Many of even our alumni, our classmates, our juniors, our teachers are very good practitioners. But the information what they have collected, or what their experience in practice, or it may be the sudden some accidentally some theories or some medicines they come across during the practice. But if they unless they publish it, so others may not know. Okay, so this is happening since centuries ago, centuries in Ayurveda. So you may be knowing many practitioners, it may be the stalwarts of Ayurveda, they are practicing, but they are not publishing. If they publish, so the budding doctors can easily understand and they can easily practice. And it's all about not only about the practice, it's about the academic growth also. And if you look at the other science, so there is in Ayurveda, in many countries, the Ayurvedic medicines are not allowed. You may be knowing about Dr. UK Krishna. So since many years we are attending his seminars, our guest lectures. So he said he is not allowed to prescribe any medicines in Japan. So because of the medicines are the Ayurveda is not scientific. What they reveal, the medicines are not scientific. See, scientific, the way the scientific, the meaning is it is not as per the steps of research process. For example, if any medicine you take, so it may be an detailed drug, non-detailed drug, or if there is a reference is available in any Samhita, so the medicine has to be as per them. The medicine, the data should be available from the literary research. Next, the preclinical studies, it may be experimental study, or it may be in vivo study, in vitro study, or it may be the animal experimentation study. Next, the pilot studies, phase 1, phase 2, phase 3, phase 4 clinical studies. Next, that medicine has to be released into the market. But unfortunately, so many Ayurvedic medicines, they are practiced. See, just to see the Charaka Samhita, Shushruta Samhita, those belongs to 4th century. And as per the data available today, so since 4th century, they are in practice. So for that, as Ayurveda is an Indian system of medicine, so as per the act, the Ayurveda medicines can be directly practiced from the phase 3 clinical trial. So phase 1 preclinical study, phase 1, phase 2 clinical studies are not necessary. Phase 3 clinical study directly our medicine, if there is a reference is available about the medicine, directly we can start the study from the phase 3 clinical study. But the reference is not available, then we have to start from the beginning, later research, experimental phase 1, phase 2, phase 3 and phase 4. See, when we are trying the medicines or we are doing the research, we are entering the clinical research in phase 3 clinical trial. So other countries are not accepting it. See, they say the medicine has to be tried from so preclinical study, phase 1, phase 2, and phase 1 and phase 2, phase 3, phase 1 and phase 2 are having more about the safety precautions, dosage, pharmacokinetics and pharmacodynamics. And any medicine, when it is given to the patient, they expect. So, what is the action of the medicine? So, either it may be systemic action, or it may be or in terms of target organ action, or it may be the dosage of the medicine, or it may be maximum tolerated dosage, or it may be a fatal dosage. So we are lacking in these type of data, so they are not accepting. One point. Second thing, many funding agencies, for example, many funding agencies, even though they ask the medicine action of the medicine. For example, you can take the medicine action, how the Kaishora Gulu acts in the body. So if they know about Ayurveda, how in the, either it may be in the dosha, it may be helpful in elevation of one dosha, or it may be helpful in the treatment of some dhatu. But those people are not familiarized with the Ayurvedic terminologies. So that is becoming a biggest hurdle in publications as well as the medicine practice in other countries. Okay, with this preliminary explanation. And another thing is, so before starting my presentation, why we need research in Ayurveda, and second thing, what is evidence-based medicine. These two terminologies we should know. See, research means growth. For example, if we are not inculcating the research in the practice, we are not inculcating the research in the academics, so we are lacking behind. We are not competent enough. Why? Because for example, we can take by the research only we can standardize. Even many a times, Dr. Praveen Patil sir, we discuss these things. So whenever you want to standardize, there must be a repeated researches. Repeated research, at the last we can conclude that okay, this can be standardized like this. One example I can give, the kshara, the preparation of kshara, or it may be the depth of burn, how much we can do in Agni Karma, or you can the Jalokavacharana, how many hours or how many minutes you have to apply. See, these standardization we can perform, we can make with the help of only the research, the repeated researches. Okay, research is nothing but scientific publications. So whenever the systemic evaluation of any concept, systemic evaluation of any medicine. So when we carry out through the steps of research process, and later we can conclude, we can make the discussion, and at the end there will be results. See, when repeated, one person will do one research, and another person will continue with another research. So another person will continue with this longitudinal study will go on. When longitudinal study will go on, so the depth of that particular topic will come to know, and that will enhance our knowledge. And for example, you can take any medicine in allopathic system of medicine, allopathic system. See, each medicines have so starting from the structure, so starting from the medicine dosage, so tolerated dosage, fatal dosage, antidote, pharmacodynamics, pharmacokinetics, and interactions of the medicines. That also we know. And about if you come to the Ayurveda, see the medicines are safe, medicines are practiced centuries ago. So the problem is we are not scientifically proved those medicines. Yes, we are practicing those medicines we are giving, but those are not scientifically proved. So for that we need research. Another point, what I want to highlight is uh, the evidence-based medicine. Madam, I am audible to all, no?
Yes, yes, absolutely.
Evidence-based medicine. Evidence-based medicine. Today's practice is evidence-based medicine. Evidence-based medicine
Audible,
is
you are
about
audible.
integration of what actually patient required. Second thing about the doctor skill, and third things about the updation. See what actually, for example, if you think about appendicectomy, just 10 to 15 years before, there were 90% appendicectomies were open appendicectomy. Last, there is a revolutionary changes I have seen in laparoscopic surgeries. Last 10 years, so 99% appendicectomies are laparoscopy. This is updation. Actually, what patient want early recovery, so minimum damages to the tissues, and patient can without any much complications, uneventful. So post-operative should be uneventful. See, patient want this. And second thing, the skilled surgeon or skilled doctor, skill. And third thing about the updation, whether the doctor is updated or not. This is about the integration. See, integration of all the three we call evidence-based medicine, and evidence-based medicine is the current trend of practice. Okay, so One is Ayurveda needs research, and second thing, the evidence-based medicine. So if we adopt evidence-based medicine our in today's practice, definitely, so we can also practice much better than other sciences what the others are practicing. See, what is publication? See, publish is means we are generalizing or we are showing or we are sharing the information. See, somebody may write a book, somebody may write an article, or it may be research paper, or it may be a presentation, but it should be an authenticated data. See, suppose if I want to publish in any article in any journal, so simply they will not accept. They have their own rules and regulations, and they will verify whether this research is carried out or not. And third thing, how scientific it is, whether he has followed all the steps of research process or not. Okay. So the published in a journal or a conference, either we can publish an article in the journal, or it may be we can present in any conference. See, in conference also there will be a chair, but first we will send an abstract, and after that they will accept, and next that they are allowing us to publish, means acceptance of abstract is also important. Then only we publish, then only we can present it. See, it is any when we are conducting any research, when we have some evidences that can be published with the definite rules and regulations, that is the scientific publication. See, why we need to write and publish the articles. See, many, even the students, even in undergraduation also, the research methodology is included for 50 marks, because every person will not get opportunity to do the post graduation or PhD, or he may not become, there is a less chance of become, means everybody will not become a doctor, everybody will not become a teacher, but the 90% of the students, 90% of the outcomes of the institutions, especially belongs to Ayurveda, they start practicing. But when they are unaware about the research, or when they have the when they don't have the knowledge of research, see, even though they are very expertise practitioner, or even though they are coming across repeatedly the rare cases, or maybe they may be having some advanced concepts in the practice, they, when they don't know the research, how can they publish? Their knowledge become restricted to them only. See, because by knowing that, one another thing is, once you have the knowledge about the articles or reading articles, or you know the citations, so definitely you can also cite some articles, and you can inculcate the information in your practice, and we can grow better. We can do better justification to the patient. See, the one thing is, so altruism, so contribute to the global knowledge. See, whatever we publish, so that will be, that's some best media, so where we can globalize the knowledge. For example, today I publish any article, and that article can be seen by, say, if it's an open article, so everybody, see, some articles, so some journals are open to all, some are, they charges some fees to see the articles. See this Dhamma Samat, and whenever we publish in any article, see, anybody can see without advertisement, anybody can see, and the person sitting in any corner of the world can easily see, and he can follow you, or he can inculcate. And especially it is more required for Ayurveda. The Ayurveda medicine can be, we can made globalized. It is now restricted to only to India. The other country people can also accept Ayurveda by knowing through publications. So that's altruism. Second thing is self-interest, career advancement. Many a times we come across, the person is published one article, and see, everybody will do the Google, so he will search. Suppose, let me give an example of our own practice. See, whenever you search any fistula, is there any best available treatment for fistula? Suddenly you will see, you will see many number of options. In that, the first will be the Kshara Sutra. See, Kshara Sutra is less invasive, and there is a less chance of reoccurrence. Okay, and patient can be go home with daycare surgery. See what actually patient needs. That when patient is seeing, when patient search it, definitely If there are articles published in the journal, published in the any journal, so definitely those are seen. Suppose if any such articles are not published, definitely even though it's a good treatment, it is not available. The Google may not show it. See, a person can become more popularized. Person can make name with the help of publications. If, for example, somebody have published one rare case. If, for example, you may be a Sridharyam, maybe Adu sir is well versed about it. Many uh, many abroad patients are visiting to that center for the eye treatment. That is because of they are publishing. When the data is published, others can easily see, they can refer, and they come for the treatment and share rare findings and experiences. For example, see some cases are not much common. Then they are not seen routine in the routine practice. When somebody are coming across the in the some rare cases, when they publish it, say it may be one in thousand, it may be one in 10,000. So those rare cases when they publish, suppose a case come to a budding doctor, immediately he can refer and he can make the treatment, or he can just explain to the patient. This is all possible with the help of publication. See, there is a one thing, we can enhance the global knowledge, or it mean in terms of Ayurveda can be made globalized. And second thing, it may be a self interest. So it may be, and many times in if you go to in even central government appointments, so they ask these many publications in peer reviewed journals, okay, or the UGC recognized journals. If there is a, when there are publications, so those will that will increases the his impression on the evaluators. And sometimes the presentation, the publications are compulsory. Next, so when you share some findings and experiences, definitely those are going to helpful for the budding doctors. Even if it is a rare case, it's useful to all. So the importance of scientific writing or publication. So first thing is the globalization, what I was telling about. So Ayurveda can be made globalized, and there may be a lot of opportunities can be made with the help of globalization of Ayurveda. And other countries can also can accept with a scientific what researches we are doing, that has to be published. Next, that personally that gives a good name and even promotions, even many other in the institutional academic growth. So for the promotion, that there must be some publications and enhance the knowledge of the person. See, it is going to, suppose for example, in one knowledge, for example, rheumatoid arthritis you can take. One rheumatoid arthritis, there are 50 publications you get. See, one person have given one medicine, another person have given another medicine, another person have given medicine with some treatment, another person have given both the medicine plus the procedure. See, and he will publish, he will discuss. So the pros and cons of that medicines. See, that will help in which we can make the standardized and we can give best to the patient. That's the practice called evidence-based medicine. And lastly, the standardization. See, when repeated researches are conducted, repeated presentations, repeated scientific writings, so definitely that is going to standardize. This is the standard treatment available for this. For example, you can take, so for tuberculosis, so the AKT4 is the standard treatment. How they have made a standard treatment? Because of the repeated patient review. So the prevention of reoccurrence. And third thing, so there will be a complete resolution of the disease. See, this is all on the basis of again the presentations, the researches. Okay, so in nutshell, one is globalization, second thing self growth, and third thing enhance the total the growth of the science, and third thing, so we can make the standardization is much needed in Ayurveda. Okay, the importance of scientific writing. So why a person required or need to scientific publications? See, it may be an practitioner, Madam Savitri Madam, she was telling. So always, so for in this year we're preferring more about the clinical aspects because we're all practitioners. Definitely, you are all good. We are all good practitioners. But when we publish the data, so then others can also be benefited, and you are also recognized all over the world. The standardization of knowledge. So we can do the standardization of knowledge. Second thing, promotes the collaboration. See, many a times there may be integration of two sciences. It may be Ayurveda medicine and allopathic medicines. When you are integrated and medicines are given, so that can also be a collaboration. That those medicines are also those research articles are also more useful. It builds a professional portfolio. When you are publishing, suppose you are repeatedly publishing an article, it may be case studies or case series. Suppose you are publishing an article on gout arthritis for 50 cases or 100 cases, so you can build your own professional portfolio. By that, other can easily recognize you, and patient may come to you with a uh, with a gout arthritis because he has treated the many number of cases with a with a definite line of treatment, and many times recognized by the government and non-government alliances. See, when you are publishing, you, for example, in a nature journal, so when you publish in uh, articles in some recognized or peer-reviewed journals, so those are all paid journals. See, the government will fund for crores together. Suppose if it is an that if you publish that article in some peer-reviewed journals, the government will fund for that, and that's an requirement for the funding. And even some non-government agencies also they ask. So, are there any articles you have published? In which type of journals you have published? Either it may be a gray journal or it may be gray journal. So some people will pay and they publish it. That is secondary. So there are some standard or peer-reviewed journals. If you publish in that, definitely it will be recognized and we can get the funding. And the dimensions of publications. So what type of publications we can do? See, it may be a case report. Case report means if you are coming across repeated such cases, for example, if you are finding a new medicine which is already explained in the if there are if the medicine is explained, references are available in the classic, and you are practicing that success story, we can practice. For example, if you are identifying some medicines, those are helpful in pre-diabetic patients or diabetic patient in the reversal of diabetes, definitely it's a good case report. And second thing, it may be about the case series. For example, you are getting the same repeated cases, for it may be the pelvic inflammatory diseases. See, you are getting a pelvic inflammatory disease and you are getting a good result out of some medicine. And you are publishing around 10 patients, 20 patients, 30 patients, 50 patients, 100 patients, and that become a standardized treatment. Okay, that become a case series. When you are publishing, there will be personal growth, science growth, and you can globalize the Ayurveda. And it may be a thesis or dissertations. You might have seen in post graduation, or it may be in the PhD, or it may be a teachers. So when you are a detailed assessment from the literal review to the conclusion, so then it become a thesis, and there will be a time duration. It varies from so 1.5 year to the 5 years. Even it may be in teachers dissertation, it may be a 10 years also. And research articles. See, research articles is not always about the the diseases. So it may be a concept also. For example, always we say so some the repeatedly those who take the calcium tablets, as per the theory, the calcium tablets, the repeated intake of calcium tablets may lead into the stone urolithiasis, or it may be a renal caliculi. See, this is one theory, but it is not a proved thing. But so we can publish an article. See, we can publish an article. We can saying that there are thousands of cases we come across. Those who are receiving calcium tablets, but there is no evidence of renal caliculi. See, there is one theory we can disprove, because many times whenever you open the book, there will be increased intake of calcium, or calcium containing medicines, or calcium containing diet may increase the chance of stones, calcium oxalate stones. But we can disprove the theory also by publishing the articles on 50 patients or 100 patients data when we have. So that's a research article. See, we may publish article on any the concepts, or it may be, so for example, so the theory says the diabetes is related to the the family, the familial, or diabetes may be related to the diet, diabetes may be related to the stress. See, you can add another more, another point, maybe medicine induced diabetes mellitus. It is also possible in future we may come across. See, we will when we come across, suppose somebody have published that medicine in so I am telling one example, medicine may cause some diseases. See, repeated intake of this medicine may cause some diseases. So that can be published. See, when it is published, so others can easily refer. It may not be a proved data yet, but it may be his observation. He come across. See, he might have seen in 10 patients. 10 patients. So those who are receiving these medicine and it is causing so and so disease. So yet he is in the pathway. It may be the research may be in the pipeline, but yet it is not approved. But he can publish an article by saying that so this medicine is may causing this disease. So that is a research article. Okay, but that has to be a scientific study, and it may be a books or manuals. So we can publish a book or it may be a manual. And second thing, a research grant proposals. So whenever it may be a research grant proposal is also a scientific publication. Simply they will not grant any fund. So we should publish either what preliminary data research work we have. On that basis, we have to apply for the grant. Then only they will grant the fund. See, now what we are all discussed about the scientific paper or scientific the or publication or need, today's need. Next point is what are the structure of scientific paper. Suppose anybody want to publish any article, okay, it may be a practitioner, it may be an academician, okay. So when it is scientifically observed, so that he can publish. Suppose you have an observation of one patient data, so successfully we have treated, you have all the data, but you don't know how to publish the article. See, many of our seniors are very good practitioners. They have thousand patients, they have hundreds of patients, and they have treated hundreds of patients successfully, but they don't know how to publish it. When they are not publishing it, they are also not growing, and they are also they are not helping the science to go. Okay, and it is also that is going to benefit a lot of people. The same treatment can be adopted and can be practiced. Okay, so the structure of a scientific paper, actually it's an IMRAD format. IMRAD format. So introduction, materials and methods, results, and discussion. See, it's an IMRAD format is the structure of scientific paper in nutshell. But in detail, when you see, it's a title, author, so abstract, introduction, materials and methods, result, discussion, conclusion, acknowledgement, and references. See, each step has its own importance. For example, suppose it may be a case scenario. So it always in the title it should be very specific and concise, and it should reflect aim and method. And third thing, it should not be always we should avoid question format if possible. For example, this is one article what I have published in IJP. See, effect of Lekana Karma and Gomutrarka Parisheka in the management of Dustavana. So which is non-healing ulcer. See, the topic here, the aim is I want to prove that the effect of Lekana Karma and Gomutra Arka. So the effect of Lekana Karma and Gomutra Arka Parisheka. Parisheka is the procedure in the management of Dustavana. See, I want to prove so Lekana Karma and Gomutra Arka in Dustavana. So it is my aim. So what methodology I have adopted? So it may be the Parisheka. So that so materials and methods, what drugs we are using, what study design I am using. So that is the method. And this is about the title. Title always it should reflect, and it should not be too lengthy or too short. The aim is it should reflect the medicines and what procedure or what type of study you are doing. And third thing, it may be it's a, what type of study. For example, it may be a clinical study, or it may be an experimental study, or it may be analytical study, or it may be an sometimes it may be literary work also. Okay, so when it may be you want to do the 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 in detail collection of the information about one disease or one topic, then it may become a literary review. Okay, so sometimes when it is about the disease, when you are trying some medicine, it becomes a clinical always it reflects the patient. When you are doing on some patient, it becomes a clinical. Preclinical, it before trying on patient, it's on preclinical, means it may be in vivo, in vitro, or it may be on some animals. Animal experimentation comes in preclinical studies. Okay, clinical, it's always on the patient. Okay, what type of study? It's a clinical study. What type of study? It's a literary study. What type of study? So it may be analytical. So for example, you want to know what is the chemical constituent of any drug, we'll go for analytical study. A pharmacoanalytical study of some guruchi. Pharmaco means when you come to know the content. So what is the content? What is the active principle of that medicine? So we can try on some disease. For example, so if it is a papain is the for example, what a PhD work I am doing. So the papain is the best debridement. So it is helps in debriding it helps in debridement of the wound. See, the papain the papain is the molecule or active principle which is present in the papaya latex also. Papaya means carica papaya carica papaya. See the papaya latex, papaya leaf, so papaya seeds, and even in the papaya stem also there is a papain. But highest quantity of papain, that the active principle present in the papaya fruit, the raw fruit latex. See the active principle when you study, and even in other drug also the papain is available, but papain is more available in carica papaya latex, that raw fruit latex. See, when we come to know in the analytical study, the papain is more in such kind of medicine, so that medicine can be taken and tried for the as a debridement, okay, or a debridement of the wound. See, such information will get in the we will get in the research, and when somebody is publishing that, others can also come to me. See, the author, see, next point comes about that maybe one author or many authors. The one person who is contributed actively, or when his creativity owns creativity, so then he become a first author. It may be, so there may be four people are doing the research. In that, one person will be the corresponding author, and he has taken the research question, and he has tried, and he has taken the help of others. Then those become co-authors, and the one person who has started the research and he has carried out the research, so he will become the author. Okay, should contribute creatively. He is the first person. Okay, he is the first author, and there are many co-authors. See, author number one, author number two, author number three, are many are also authors. Okay, see, and many the recruitments, they ask how many first author publications you have, or how many authorship you have. See, first author is given prime importance. Okay, how many first author publications you have? For example, you have 10 publications. In that, four are first author, in remaining are second author or third author. See, they give more importance for first author because he is the corresponding author. Okay, so the initials plus surname. See, for example, in previous slide, see, you can see the the first author, Kumar Kanthimath, he is the first author, and Tyagaraja C is the second author. So Tyagaraja C, he has indirectly helped, or he may be directly helped, but as he is not helped as like the first author, means he is a co-author. So he may be, for example, suppose you are doing a research work on blood samples. See, you are doing the research, but some pathologist may become a co-author because he also contributed for your research. See, you can because so he is also added one publications, and you are also added one publications, but you are the first author, he is the second author, because He has helped you. It's your duty, it's your ethic to mention his name because he has helped. Okay, so that's a co-authorship. And writing an abstract before writing any article or before sending any article to any publication, so we need to know about the abstract. Abstract is nothing but a quick summary of any paper. If, for example, whenever you want to present any article, whenever you want to present in any seminars, they ask you about the abstract. Abstract is about the summary of your result, what you have done. Okay, so that includes introduction, that includes materials and methods, so that includes discussion part, and that includes conclusion also. And in that, so you may see the word is missing here, keywords. In the abstract, you will mention about the keywords, that those keywords are very important in the search engine. For example, somebody is searching in the internet, okay, somebody is searching in the Google, so those keywords come in front. For example, the Kshara Sutra and Bhagandara. So suppose you have mentioned like a keywords as Kshara Sutra and Bhagandara, definitely in, and those words are present in the title, definitely that is shown in the search. For example, a Kshara Sutra and Bhagandara. So whenever somebody search like, is there any better treatment for fistula in or Bhagandara? Definitely the Kshara Sutra comes in front. See, when you have mentioned keywords, so for example, in this article, the Gomutra Arka and Lekhana Karma. Suppose somebody search like a Gomutra Arka, immediately my article comes in front because so the Gomutra Arka is a keyword and it comes in search engine. Okay, and it reflects objective. See, there is a difference between aims and objective. Aim is nothing but what I want to achieve. Objective, how I am going to achieve. For example, I want to achieve the effect of Gomutra Arka in Dushtavarna, and how I am achieving, so that comes in objective. See, first I have studied in detail, I have diagnosed the conditions of Dushtavarna, I have done the parishek of Gomutra Arka, and next I have analyzed, next I come to know about the result. That's all objective. Okay, aim, what I want to achieve, objective, how I am going to achieve. Okay, objective, method and findings. And introduction to the essentials. Okay, so the purpose and significance is most important. See, why this type of article you are publishing, or why you are doing a research on this topic, or why you are publishing this case series, that the purpose we have to mention. For example, see, there must be some research gap. For example, maybe there may be a good treatment available for one disease. You should find some research gap. It may be the medicine may be costlier. Medicine patient has to take for longer duration. Our patient may be producing some side effects or ill effects, or the medicine is causing reoccurrence of the disease. See, we have to find some research gap. Even though the medicine is practiced, medicine is there in the market and it is practiced, but we have to find some research gap. That is the purpose. So where the previous study is standing, from where we have to start. That is the purpose. That we explained as a need of the study. What is the need of this study? If, for example, see, there may be a Shweta Pradara condition. There are many number of patients are suffering from Shweta Pradara, and you are treating it successfully. See, and what is the present line of treatment available, and you are treating with your experience. See, there you can fit your research gap. Okay, this medicine is better than existing medicine what is practiced, and this medicine will help the patient. That's a again evidence based medicine. See, that is the purpose. And we have to show the significance. For example, one criteria, it may be about the time duration of the treatment, or it may be the cost effectiveness of the medicine, or it may be the preventing the reoccurrence. See, that significance we have to show. Okay, so our medicine, or our research medicine, or trial medicine, or our article what you are publishing, so the aim of that article publishing, how it is better than other, so that we have to show. And background and literature, see, simply we cannot publish any article without the background information, whatever the information available about current, because you may be publishing the data, you are not knowing that data may be already available. or somebody has published. Okay, so the background data we should have, and the literature also. Without the brief literature of the disease or the concept, we cannot conduct the research, or we cannot publish the article. Okay, so literature, because the the author should know the minimum knowledge of that disease or that concept or that medicine or that study. Then only he is allowed, the editor will accept your article, then it is published. Otherwise, without the knowledge of literature, your article they will not accept. And what type of study design you are selected? Study design means, it may be study design means, so it may be experimental, or it may be clinical, or it may be an observational study design, or it may be an pharmacoanalytical study design. What type of study design you have selected for your research work? It may be clinical, simple. Many are practitioners here, so you may be selected as one simple topic for simple, like the effect of the Ashoka or Ashoka Ariska in pelvic inflammatory diseases. See, it's a clinical study. That study design is a clinical study. Next, the scope and contribution. See, what is the scope of this study and what is the contribution to the science? That also important. That become an essential part of the publication. What is the scope? See, when I have published some article, for example, so that is going to help for the other budding doctors, and even some other science, other the contemporary sciences doctor can also refer that article, and they will refer the patient by saying that this, for this disease, this is the good medicine how is available. For example, many patients come to Ayurveda for the skin diseases or neurological impairments, or for the correction of the eyesight. See, people will come to Ayurveda. That is the scope. Even there is the limitation of every science have their limitations. We have a lot of potentials in Ayurveda, but we are not exploring ourselves. That is the drawback. That is the limitation of Ayurveda. See, when we are exploring, the people will refer and come to us. Now, because of there is increased publications by the Ayurvedic doctors, so many allopathic doctors are themselves they are coming to Ayurveda for to take the medicines, because there is a scientific articles what we have published, what our doctors have published. This is the biggest contribution. Okay, in future another 5 years, because last 5 years, comparative last 5 years, there is a lot of advancement, and lot of many people are publishing the articles, because so only many recruitments they have made compulsory. How many publications you have? The publications, one is it is helpful for personal growth. Second thing, it is helpful for the growth of the science, and we can make Ayurveda globalized. Materials and methods, again it's about the study design. Data collection method, how you are collecting the data. Data collecting, your method by the history taking, or you are doing the examination of the patient, or so it may be by the investigations, or by some radiological investigation. See, we come across repeatedly the case studies. For example, practitioners, before and after data we should collect. For example, before treatment, what data patient, what data says. For example, is diabetes, so the blood sugar level, so HbA1c was 9, and after the treatment, so the HbA1c is 7. It's a data collecting by means of blood investigations, data collecting by means of the investigation, by the examinations, data collecting by the means of patient history. Many times we should make a patient video clips also. So before treatment video clip and after treatment video clip. This is how we can publish those data are required for the publications. See, data, the editor requires the authentic data. Simply we publish like so many doctors claims that we have seen thousands of patients. I have the experience of 10 years, but I don't have data. Then it is not accepted. Then it is not accepted by any sciences. Even I also not accept. Even you also not accept. Suppose if I tell like, see, there is one good practitioner in Belgavi and he's practicing, he's seeing every day 1,100 patients of cardiac disease, cardiac pathology, and he is treating successfully, but he has not published any data. That data will not accept, because the data when you publish, they evaluate. Editor will not accept easily. Okay, he will evaluate, evaluate. If it is a peer-reviewed article, it takes 6 months, 1 year, 2 years, 3 years, 5 years for the publications. See, that is the data. Data must be authenticated. Otherwise, if the data is not authenticated, nobody will accept. Leave about the gray journals. See, inclusion and exclusion criteria. See, I am telling my data is scientific, then it should be that should be what type of patients you have included, what type of patients you are excluded. That becomes more particular. See, you have treated only because your criteria is you are treated only the patients with the elderly. For example, from the age of 50 to 70. For example, prostate enlargement. You have treated the condition with the prostate enlargement from the age of 50 to 70 years. And the patient unusual prostatomegaly in 30-year old age. Patient may come to you and you may say that this data support only the patient from the 50 to 70 years. It becomes more narrow and more scientific and more standardized. And you are telling that it's something unusual. The disease included in my research or article publication is 50 to 70 years of criteria. See, then it will become more narrow, more scientific, more standardized. Okay, inclusion and exclusion. Okay, the patient with uncontrolled diabetes, especially because the diabetes may change the values of your disease, or diabetes may influence your result. So you are excluding it. Means you are becoming more particular. See, first we have to study on only the disease alone by excluding the diseases. Later, the study gap, research gap. Another research work may do the research work diabetes with plus disease, hypertension with the disease. So, rheumatoid arthritis with your disease. See, by the addition of this disease, for example, because those are the systemic illness, many patients have those diseases. Okay, and the tools what you have used. See, to collect the data or to diagnose the condition, what tools always today Ayurveda, we are the doctors, Ayurveda doctors, we should make better use of the blood investigations or the video clippings, or it may be radiological investigations. By that, better we can prove, better we can publish. Okay, we can show the evidences. Okay, if it is necessary, I am telling. Unnecessarily not required, but for publications we required. What is the, because see here, let me comment. Ayurveda is more about the qualitative analysis, not the quantitative analysis. But evidence-based medicine wants quantitative. For example, if I say like before treatment, so there was Vatakshaya Lakshanas. After treatment, there is a so Vata dosha has increased. Now the patient have lived with a complaint, but we don't have the data to explain about the quantification of a Vata dosha. But the scientific publication requires the data quantitative analysis. So unless we have the quantification for qualitative analysis, also there are some statistical tests. Okay, so like a Mann-Whitney test, or it may be the ANOVA. So those are useful, but we cannot prove as like quantitative data compared with the qualitative data. Okay, we required tools for the publications and statistical methods. Okay, so next, the presenting the results. See what presentation, the results are nothing but what observations you have seen throughout the study. It may be a case report, it may be a case report, or it may be a preclinical study, or it may be an analytical study. What you have collected the information, that becomes a that we have to explain with the help of that we have to conclude with the results. See, it should be concise. The word structure is very broad here. It is structured means the data, it should be the from means we generally use name, age, patient sex, so the patient in community what he belongs to, so and patient symptoms, that all comes in, that's called as a structured. Okay, next we should use tables, charts and images. For example, if anybody want by seeing by after my presentation, so they want to publish any article, so always our data must be, the results must be in the form of tables. But tables, charts, if for example pie chart, whenever we use tables, charts, always it's eye catching. Your article can be easily referred by somebody and they will understand very easily. Okay, those are all eye catching. Easily they can understand. See, this is the chart. How many patients they have seen? What will be the result? So, what is the before treatment? What is the temperature of the patient? After treatment, what is the temperature? Before treatment, what is the actual percentage? After. So, suppose if you explain in one paragraph, nobody will have the time, or it is not eye catching. When you have present with some with the tables and chart, easily can they can understand. Even with we can make a better use of images also. Mention some unexpected findings. Always, this is having a more scope. For example, whenever you are treating one condition, for example, you are treating one condition of the diabetes, and if the you are treating diabetes and it is increased patient libido, if it is increased patient appetite, if it is increased the patient, if it is helpful in the treatment of some skin diseases, then it's unexpected finding. See, your target is diabetes, and you have come across some another unexpected finding. The patient will come and tell you that. So after taking those medicines, so my sleep has been increased. My sleep, I am doing sound sleep. I am getting sound sleep. So before I was suffering from the constipation. Now the bowel is very clear in the morning. So now the amla pitta is reduced. See, when patient is giving the history, that's unexpected finding. That is again, it's a research. One medicine may be having many indications. Okay, so that we can come across in this type of condition. That when you mention that, that becomes a scope of further research. Suppose if I mentioned like suppose like ashwagandha is best. Ashwagandha is best. It's a rasayana in geriatric conditions. If it is producing sound sleep in patient, it's another research dimension where ashwagandha can be used in insomnia. In another condition, ashwagandha is increasing libido. Yes, ashwagandha can be used in male infertility. Another indication, ashwagandha is increasing muscle bulk. It's an unexpected finding. Patient may tell that, so after taking ashwagandha, so my weight is increased. You can take ashwagandha as a ashwagandha drug to increase the weight in Karsha patient. This is unexpected patient findings that become a scope for the further research. So I am audible. Am I audible? Hello.
Yes, sir. Audible, sir.
Yes, absolutely audible.
Okay. So next point comes about the discussion. See, everybody will see the discussion part. Discussion always in author's word. So there is no copy and paste here. Discussion, how the study, starting from the need of the study. So how the study is carried out. So what is the study design, and what are the advantages, what are the disadvantages or lacunas in your study. And next, what is the further scope of research. See, whenever we send any article, suppose if I referring an article written by somebody, so what first I will see? First I will see the discussion, because those are the author's words. See what author, see he will explain in his words. For example, so in that the need of the study, so I have selected this study. I have published this article because so I have come across so and so. It may be a rare disease. I am getting repeated diseases like that. So I am. These are the unusual experience of the patient or unexpected the findings of the patient. So I am publishing. Okay. So that's one point. And second thing, the study design may be many. So one person has taken another one study design. You are doing another study design. For example, see, somebody has taken an experimental study. When you are studying, so somebody, you have the preclinical data like, so one medicine is more useful in cancer treatment. That is studied on some rats, rabbits, mice, or rodents. See, with that data, you can try on your patient. So that becomes and clinical data, clinical study. See, that medicine you can try on patients. Okay, so unless you have the medicine is proved safe in preclinical study, then only you can start in animals. If the preclinical study that medicine is that medicine they have mentioned like the medicine is having more toxic. The medicine dosage is yet not yet the medicine dosage is not concluded. Then the medicine cannot be administered on human beings. So that is the importance of preclinical study. In preclinical study, The medicine has to be proved safe in all the corners, starting from the dosage, the maximum tolerated dosage, to the fatal dosage. Then only we can carry out the study in the human beings. First, the medicine has to be proved safe. See, the in the discussion part, he will mention that I have selected so and so study design. So another person can take another study design like what actually the medicine contains, like a analytical study. See what is the chemical constituent or active principle and chemical constituent and its proportion also will come to know. See, there are four medicines. For example, there are Jatamamsi, Thagara we can take, Sarpagandha, Ashwagandha. There are four medicines we have. So blindly we are giving the medicine to in the patients of insomnia. See, among the four medicines, which medicine is suitable in which condition? One doctor have published his article on ashwagandha in insomnia. So jatamamsin, another condition like insomnia condition. So sarpagandha. So like that, there are 8 articles are available. When you read all the 8 articles, you will come to know for which type of insomnia conditions we have to give which medicine. That is the importance of article. We have the one medicine have many amayuka prayogas, but we'll come to know the one which medicine is effective in which condition by the publications. When author have discussed, so he may be telling that so the patient may be having a sound sleep, but it's very short duration. In that, the Sarpaganda, what I have studied, Sarpaganda has shown very good result. Another person in geriatric insomnia conditions, ashwagandha may be very good. In patient with some stress and anxiety, so Tagara may be very good medicine. See, when we have the different researches, so when these are published, definitely that is going to help in the practice, that is going to help in the standardization. Okay, and he will compare. So with the previous studies in discussion part, he will compare like a previous author, a previous study. So it was like that. It was carried out that like that, and I am comparing. And these are my studies in comparison with that study. Okay. For example, Jatamamsi and Sarpagandha. Okay. So take an example of Agnitundivati and Chitrakadivati in Ama condition. See, in comparison with Agnitundivati, Chitrakadivati is better in which condition? In comparing with Agnitundivati, Chitrakadivati is best when it is best. See, in even in Vibandha condition, we come across many. It's like we use Trivrut Leha, so we use Ayurveda Churna, we use Senna or Sonamukhi powder, so we use Trifala, so we use Icha Bedrase. See, which medicine we have to use in which condition, so that's where the comparison will come to know. Okay, with a compare. See, one article is published on Avipatikara Churna, another article is published on Analomana Churna, another article is published on some other drug like Haritaki. So another article is published on Aragvada. See, when 4 articles we have, all are in Vibandha condition, we'll compare. Okay, so the author will discuss the comparison. Next, strength and weakness. Himself, he will definitely tell about this medicine is useful in so and so condition. This medicine may not be. This medicine is not proved better in so and so condition. That becomes a weakness. Maybe to increase the we have to increase the dosage for the better. He will discuss like to increase the dosage of the medicine to get a better result. But medicine may be bitter in taste. That become a weakness. Okay, medicine may be very good in action, but medicine may be bitter in taste. That becomes a weakness. So medicine has to be taken in large quantity. That become a weakness. Okay, medicine is very costlier. That become a weakness. Medicine is very effective. Medicine is very much cost effective. Medicine can be palatable. That become a strength of the medicine. Medicine we have to give only for the shorter duration. That becomes a strength. Okay, so the author will discuss strength and weakness, advantages, disadvantages in the discussion part, and also he will suggest some for the budding researcher. See, study can be continued. See, this is my research. Another can so the next budding researcher can continue the research. That is the discussion in the discussion part. That's the scope of the research, or what we call it the research gap. The author himself he give the clue that this study can be. For example, If somebody are doing a research work in cancer, so his research work is on cancer. So this medicine may be very effective in the side effect or minimizing the side effect of chemotherapy. For example, we become a so very narrow study. See, very pinpointed study like a so the chemotherapy vomiting. So the patient, the the vomiting can be better treated with Ayurvedic medicine with the patient those who are receiving chemotherapy. See, this medicine is more useful in chemotherapy-induced vomiting. So only in old age patient he may conclude, and the study can be continued in the younger generation patients. See, this is how the suggestions of the author. The researcher, the budding researcher will take this point or not. That is secondary. But before publishing any article, we have to read many such articles, where the author have discussed many things. Okay. And conclusion, reflect on the research question. See whether your research question, what doubt you are having before starting your research, before publishing an article, whether you have justified or not, whether you have proved that medicine or not. That research question you have to explain in the conclusion, and you have to, yes, my research question was so and so, means I am treating amla pitta and so medicine. Okay, that research question. See, Agnitundivati is effective in the treatment of amla pitta or kafaja amla pitta. So that is your research question. Yes, you should reflect. Yes, that medicine Agnitundivati was better effective, better medicine in the treatment of amla pitta. That you can solve the question or you can explain that. That's the reflection, and highlight implication and significance. Andre, so this medicine, how much it is important in present scenario, that implication, and whether it is becoming major breakthrough in the practice, how much is significant in practice, that you should explain. Next, make the generalized claim. Andre, this medicine can be used any type of amla pitta. This medicine can be used any type of skin diseases, or this medicine can be used any type of anorectal diseases. You can generalize the claims. For example, it comes in joint diseases. You can use this medicine in any joint diseases. Okay, so we can generalize on repeated researches and repeated publications. Okay, so and acknowledgement, and in the research article we should not forget to acknowledge those who have helped in our research work. For example, somebody have given an idea, somebody have helped in carry out the research, somebody have helped in some investigations, somebody have guided in somewhere, then we have to thank all of them. That is an acknowledgement. And always the references. See, whenever we submit any article to any journal, they see the references. So it may be reference from the Samhita. So it may be reference from any referencing textbooks. It may be in portals. For example, it may be research portals. For example, the PubMed, Medler, Scopus, or Ayush. So, or it may be any research portal. When you are drawing, we have to mention the reference. Or it may be any article. For example, somebody's article, when it is published in peer review article, peer means it's an the set of articles, those are experts. The valuation of the articles are done by the experts. That's a peer reviewed article. Peer reviewed articles having very lot of weightage in the publications, or in the even the citations also. Citations means how many are referring your articles. Okay, so the referencing is very important. Referencing always in the, there are two types of referencing. So Vancouver style and Harvard style. So Vancouver is most preferable reference style. So even you get information about Vancouver style when you search in the internet. And choosing a journal. So whatever, so you have an article, so you have an information data you have collected. So you have you have arranged the article in the as per the article publish article steps of article writing, means IMRAD format. Now whatever journal you have to select. See, the journal must be highly indexed. Indexed means how many people are referring that journal in that time period. For example, there are 100 journals. In that, one journal is most referred on that in that time period. For example, 3 months, 1 year, 2 year. So on that basis, the reference in the index is the index is drawn. So on that basis, the prestige. Suppose if I publishing an article in the I am in the integrated the journal the Journal of Ayurveda and Integrated Medicine. See, there's a peer-reviewed article and publications elsewhere publication. See, when it is published in that article, so people definitely the citations, those who refer that article, they will come to know that this article is genuine. I can follow it. Okay, so that evaluation, that prestigious, that article must be that must be a good journal, a peer-reviewed journal. Frequency, how frequently that article, that journal is publishing the articles, that is also important. For example, some articles are every month, some articles are published in some journals are every 3 months, 1 year, 2 year, 3 years. Some articles are, some journals are published in every 5 years also. Frequency also matters. Okay, and frequency means they will take the article, they receive, they evaluate, then you publish. Simply they will not accept and publish it. Circulation, how many circulations, how much circulation, whether it is in India, in other countries, international journal, that is also most important. And audience, what type of audience? It is only the medical fraternity, or only Ayurveda, only Indian system of medicines, or allopathic system of medicines, or even other allied paramedical sciences. That is also most important because you are reaching the people. Okay, so use pre-submission inquiry if needed. For example, so we should submit an abstract to any editor by asking that I want to publish an article in your journal. So such type of article you accept or not, or what is your claims. So what type of articles you want, that also the pre-submission of the inquiry to an editor, that is also sometimes most important because you are submitting an article to some journal, sometimes they straightway reject your article. Okay, so that is one thing that hinders in article writing. Okay, before that we can pre-submission inquiry we can make to any editor. See the impact factor. So the impact factor is a journal or measure of how frequently the articles are cited in other academic publications. So that is calculated how easily you can get the information. So ISSN number, it's an unique ID number. It is given to an article. ISSN number is most important. Then only that indicates that article, that journal is registered. Okay. So in totally to summarize, so abstract, what I did. Introduction, what's the problem? So what's the problem that I have to explain the introduction. Methods, how I solved it. Results, what I found. Okay, discussion, what is my judgment. Conclusion, summary. Acknowledgement, who are helped to in my article writing. References, source. References are most important. Without references, the editor will not accept and it cannot be published. Okay, so this is how we can structure an article, starting from title to the referencing. Okay, so in brief, the publication, scientific writing and publication is a need of the hour, and it is more needed for Ayurvedic doctors. And unless we publish, so our others will not come to know about my work. One point. Second thing, it will not increase it will not help the other members to grow. And third thing, even we cannot popularize or we cannot make globalize Ayurveda. Okay, so in nutshell, so personally for the growth of personal growth also it is important. For the growth of science is also important, and also when we write more and more articles, when we make some scientific writing, more scientific writing, and when you publish it, definitely there will be more acceptance for Ayurveda. So the people all over the world will accept it, and so people all over the world will be accepted, and we can also confidently do a better practice in Ayurveda. With this conclusion, so I'll conclude my presentation, and I thank all the Millennium Batch senior alumni and seniors for giving me the, for even though I am the junior, so you may be having a lot of knowledge, Even there are many a times I ask the opinion to the many seniors. So many seniors they give a valid opinions. Okay, so even though you have asked me to present to present one topic in the alumni in the alumni platform, so it's a big opportunity for me to communicate you all and to share my few opinion and words in this platform. Thank you again. I thank all the organizers for giving me the opportunity. Thank you, one and all.
A big round of applause, Dr. Kumar. Such really, what an wonderful explanation. Uh,